Good afternoon, everyone, and good morning to people on the West Coast. I'm Joe Caldwell, and I'm Director of the Community Living Policy Center at Brandeis. And I'm joined by my colleague, Teresa Nguyen, who is the Director of the Community Living Equity Center. And we're glad you joined us for this discussion today, which is really a discussion about the state of science in community living policy research. And this is going to be a series of webinars that we're doing over the next several weeks. And so, Teresa, if you go to the next slide. Today, Teresa and I are going to share a little bit of the background on community living policy and highlights of some of the research that the Community Living Policy Center is done and the Equity Center is doing. And then we hope you can join the next webinar, which is going to be on June 23rd. And on that webinar, we're going to have a panel discussion with other researchers and other advocates. And we sort of have an all-star cast here. So we're going to hear from John Cheetah from AUCD, Sylvia Yee, who's with DREDF, Amy Hewitt, who's at the University of Minnesota, Ari Naiman, who is earning his PhD at Harvard and has also been a longtime partner on the Community Living Policy Center, and Natalie Keene, who's with Justice in Aging, who's a great partner on our Equity Center. And so they're going to be asked to reflect about what, from their perspectives, what do we know and what do we need to know, or what do we need to learn? And then we hope you'll join us for the third webinar, which will be on June 27th. And that's going to feature Henry Claypool and Kim Tay. And they're going to present the findings of some roundtables that we did last fall with stakeholders. And stakeholders included people with disabilities from very diverse backgrounds, providers, health plans, state officials, Medicaid directors. And again, we asked them, what do we know in community living policy research? And what do we still need to know? What do we need to learn? And so Henry and Kim are going to share the highlights that came out of those roundtables. And we're also hoping to have Allison Barkoff from the Administration for Community Living on to share her perspectives. And I want to give a plug here for you all to share your perspectives about what you think we know, what we need to know. You can do that via the chat throughout the webinar. And we also have a survey that we're going to put the link in the chat that we hope that you'll go. And it's a very short, 3-question survey, but really to get your perspectives about priorities for community living research. And Teresa, if you go to the next slide. If you're not registered for the other webinars, you can go to our website, which is communitylivingpolicy.org, and you'll find information there to sign up for the other webinars. All the webinars are going to be recorded, and the transcripts and recordings will be available on the Community Living Policy website after the webinars happen. This is just a disclaimer that this series, this discussion is being hosted by the Community Living Policy Center, and we received support from NIDLR, which is the National Institute for Disability, Independent Living, and Rehabilitation Research, and that's within ACL. But of course, the perspectives, especially on this topic, the perspectives are really the perspectives of the speakers themselves. And you should not assume that, they represent the federal government or endorsement by the federal government. This is really just everyone's kind of perspectives about priorities for research. And so let's, get started. And the agenda really today is that I was going to start out and give a little bit of background about community living uh, policy and a little bit of the, the big picture of what we know. And some of you on the webinar are going to be really familiar with this, but I do want to kind of level set and set the stage for some of the following discussion. And we're going to highlight some of the work that the Community Living Policy Center has done, particularly over the last 5 years, where I think we've done some great work in areas, really made an impact. And then we're also going to reflect on, what we don't know and where are the gaps, where are the needs, especially in the area of equity, where I think we're just getting started and there's a lot we don't know. So this was hard to, community living policy is a very big topic. There's a lot of areas within that. And so it was kind of hard to narrow this down for 1 hour, but we're going to focus on 5 areas. The first is access to home and community-based services and unmet needs, where we have done some, I think, really exciting work and some studies about the impact of unmet needs on health and community living outcomes. And then the second topic is around person-centered planning, which is another area where we know a little bit, but we don't know a lot about, implementation of person-centered planning and the outcomes of person-centered planning. So I'm going to highlight some studies that our center's done and some other folks have done that I think are pretty exciting. But again, there's still a lot more to learn on person-centered planning. The third area is the impacts of COVID. Our center did some studies I want to share with you, but again, there's still a lot that I think we don't know about the impacts of COVID on people receiving Medicaid, home and community-based services, and something that our center is still really engaged in. And then housing, one of the biggest barriers to community living is well documented. There's a lot of research on this being a barrier, is access to affordable, accessible housing. And it results in people going into institutions and nursing homes. And really one of the biggest barriers in moving to the community is that housing. And so we'll highlight some studies that we've done. But again, that's a huge topic in itself. And then lastly, equity. And Teresa is going to share some of the work of the Community Living Equity Center. So if you go to the next slide. So just some background to sort of, set the stage. Is the best estimate that we have right now is that about 14 million individuals in the US need some form of long-term services and supports. And really that's assistance with daily activities and self-care. And we know that this number is increasing. Right now, about half the people that need long-term services supports are under 65 and about half are over 65. But, due to the aging of the population, this number is going to dramatically increase just in the next 2 or 3 decades. It's going to more than double to an estimated 27 million people. So this is a really important topic, for our country to really, face and how are we going to respond to the needs of an aging population. We know that right now, very few people get paid formal services. Only about 13% of people get any sort of formal paid service. So most of long-term services supports is delivered by unpaid family caregivers and friends. Some research from the National Alliance for Caregiving and AARP indicates that there's over 53 million unpaid family caregivers that are providing services and supports. And a lot of times, a lot of policymakers, when they hear, long-term services and supports, the first thing they think about is nursing homes and institutions. But, we've really gotten away from that to a big degree, and there's about 1.5 million people that reside in nursing homes or other institutions in the US, but the vast majority live in the community. And even among Medicaid, home and community-based services, the best estimate we have now is about 7.5 million people receive some form of Medicaid HCBS. Actually, that number, it was only about a year ago until we had that number from CMS. So there's been some advance in research there. You know, it's a broad range of services and supports. As you can see, you know, it covers transportation and personal assistance, employment supports, respite, family caregiver supports. It's a very broad range of services and supports, which makes it challenging on one hand, but these are the things that keep people in the community, living independently with dignity and respect. I think that's the way to think about it. If you go to the next slide. So, you know, Medicaid, for better or worse, is really the largest payer of long-term services and supports in the US. And I know a lot of people on this call are familiar with this, but you know, there's a long-standing institutional bias within Medicaid where nursing homes are mandatory, but home and community-based services, which are the things that people want, are optional for states to provide. And because of that, states can limit availability of HCBS. And we know in many states, there's very, very long waiting lists for home and community-based services. It forces people into more costly, undesirable nursing homes and other institutions. And this is, of course, a big focus of our center and all the research we do. If you go to the next slide. You know, we've made a lot of progress, though, within Medicaid. And this slide, what you see is the percentage of Medicaid long-term service and supports that goes to home and community-based services. And that is in the, actually, I think these colors are reversed. That's in the purple. In the blue or the green, that's the percentage that goes to institutions. And so a lot of this progress has been really recent. If you go back to 1990, you know, when the Americans with Disabilities Act was passed, we were only spending about 13% of Medicaid LTSS spending on the community. You know, 87% was going to institutions. You know, we've made a lot of progress because of Olmstead and because of federal programs and because of advocates like on this call. So, you know, now it has switched. And so we do spend the majority of funding in the community. And this is from data before COVID. You know, it was up to 59% that we spend in the community. However, you know, there's a lot of variation, you know, from state to state. There's some states that spend, you know, 80% in the community, and other states that are still, you know, around 20%. So there's huge variation. There's variation by disability population. You know, the intellectual and developmental disabilities system has really made great progress in rebalancing. Some states don't spend any on for institutional spending for people with IDD, but people with physical disabilities and older adults, you know, the percentages are still pretty low. You know, about 40%, I think, is the average of community spending, and you know, some states are really below that. So this is, we've made progress, but there's still a lot of disparities by state and by population. And like Teresa is going to talk about, we don't really know the disparities by race, ethnicity that well. We don't have a lot of great data on that. So that's a big area, a big gap. So I'm going to highlight some of the things that we've done over the past 5 years that I think have made a difference. And I'm going to start out with some of the more policy related research that we've done. And what our center tries to do is we try to work really closely with the aging and disability advocates, particularly more at the federal level. We work with a coalition called the Disability and Aging Collaborative. And we try to stay sort of on the pulse of where there's opportunities to advance policy, because the policy landscape is always changing and evolving. And, you know, but, by listening to the advocates, we try to find the areas where we think our research can make the biggest impact. And so one of the big areas we focused on was the Money Follows the Person program. And a lot of people are probably familiar with this. This is probably the longest standing Medicaid demonstration program ever. And what it does is it gives states an incentive. It gives them extra federal funding to transition people out of nursing homes and back to the community. And also by doing that, rebalance their system and get away from nursing home and more towards shifting to the community. And so this is a program. There's been tremendous research, by Mathematica and others, that really studied this program and transitions. It's some of the best research I think we have on the benefits of community-based services versus institutions. But what was happening was this program was up for renewal every 5 years or so, and Congress was sort of dragging their feet and doing these short-term extensions of the program. And what we did is we did some research to show that that these short-term extensions of the program for 3 months, 6 months, they really were, really killing the program. States were dropping out. The number of transitions had dropped by more than 50% reduction in the transitions. So this really successful program was really going downhill. And this research, the advocates used and got a longer term extension of the program. So that was really good news. And now the program's extended to 2027. We still need more states to take up that extension, and probably some research on that and why some states haven't. But that was really good news. Another area that we focused on was HCBS infrastructure. What we did was there was a program called the Balancing Incentive Program that was part of the Affordable Care Act. And as that program was ending, there was a need to sort of look, what worked from that program, what were some lessons that we learned from that program. So we did some stakeholder interviews and formed a work group and tried to pull together information from the evaluations that were done on that program. And we put together sort of a framework for new legislation that the advocates used to introduce a new bill in Congress. And parts of that bill, were included in some of these packages that recently went through. But I think there's still, I think that's still a good framework for some future legislation. So if you go next slide, yeah, the next area I wanted to talk about was highlight some of the work we've done around unmet needs for home and community-based services. And there's two ways to think about this. There's unmet needs among the bigger population who's not getting any home and community-based services. But then even among people who are getting home and community-based services, there's still unmet needs. And so for this first study I'm going to talk about, we focused on that population. These are people who are actually getting home and community-based services, but not getting all that they need or exactly what they need. And for this study, we used the National Core Indicators Aging and Disability Survey, which has been really a great advance in giving us a data set to really look at people receiving Medicaid home and community-based services. So this is a survey that states administer in partnership with Advancing States and HSRI. And about half of the states do this survey now. So it's a great data set, like I said. And what we looked at was, these were surveys done with Medicaid HCBS beneficiaries, and we looked at, what they said they had unmet needs for. And we looked at unmet needs for, activities of daily living, personal assistance. We looked at unmet needs when they said that they weren't getting the services that they needed to reach their goals. We looked at unmet needs for assistive technology and home modifications, which are some great questions in the surveys around that, and unmet needs for transportation. And, overall, there's a lot of unmet need. 81% of the people that we looked at said they had an unmet need, at least in one area. And then what we did was we looked at, how does unmet need impact community living outcomes and health outcomes? So, you hear a lot about the social determinants of health. So some of the things we looked at were ED visits, hospitalizations, preventative care. And then on the community living side, we looked at, community participation, being able to see friends and family. And really across all of these, outcomes, the health outcomes and the community living outcomes, unmet need, when people had unmet need, they had worse health outcomes, they had worse community living outcomes. So I think there's a lot of, important findings here for, for impacting health outcomes. If you go to the next slide. This is a different way to look at unmet need, and that's, really in the bigger population. So people not getting Medicaid HCBS right now. But, there's really few national surveys that we have that gives you a good sense of who out there, particularly at a state level, needs long-term services supports, and, who's not getting any sort of long-term services supports right now. And it's a gap because we don't have good data on this. So we worked with two states. We worked with Washington State and Texas, and they added some LTSS questions to what's called the BRFA survey. And this is a public health survey the CDC in the states do. And they added some supplemental questions to kind of get at that. Another state that has done it in a different way, they added their own supplement to the California Health Interview Survey. They added a whole supplement on LTSS. And so we've been working with these states and working with these data sets, but I think there's a lot of opportunity here, a lot of opportunity for other states to think about, adding questions to the BRFIS or doing supplements to really get a better sense of who in their state needs LTSS, look at disparities in access to, to home and community-based services, and really for the state to plan for the future, like Washington State is doing with their new trust fund for long-term services supports. So I think this is another area where we've made some progress, but I think there's a lot of opportunity. And the next slide. Yeah, I wanted to highlight some of the work we've done on person-centered planning. Person-centered planning is required in all Medicaid HCBS programs, but we don't know a lot about implementation and what's actually going on. And, more importantly, we don't really know much about the outcomes of person-centered planning. So we did two studies here. One was a qualitative study where we worked with a health plan and really talked to people receiving services and to the facilitators about what they thought some of the the barriers and facilitators were. This study we just published in the journal Disability in Health. So if you're interested in learning more, you can look at that that article. We've also been doing a lot of work again with the national core indicators. They added additional questions on person-centered planning. So we've been looking to see how those relate to outcomes. and we're working on a journal article on this. But to give you the sort of the scoop is that we found really strong associations between person-centered planning when people report that they're receiving person-centered planning and community living outcomes, including community participation and how satisfied they are with how they spend their days. So I think there's a lot of importance to this study, linking it to outcomes. And the next slide. Yeah, I wanted to highlight some of the work we've done on COVID and home and community-based services. So we know COVID's had a huge impact, a devastating impact on people with disabilities, particularly people living in nursing homes. But we know very little about the impact on Medicaid, home and community-based service recipients. And it was really frustrating because Congress mandated data on deaths in nursing homes and mortality in nursing homes, but there was no equivalent for people receiving Medicaid, home and community-based services, or even other types of settings. And this was really frustrating to the advocates because policy was being made and there was no data on this population. It was just an invisible population. And so we tried to fill the void here, and we racked our brain, where can we get data? Where can we get data? We couldn't get the Medicaid data for a couple years. And so we started to think about managed care, and we talked to some of the managed care plans and saw if they would be willing to share data with us. And we worked with the National Managed Long-Term Services Supports Association. We actually got 14 health plans in 12 states to provide us mortality data on the Medicaid HCBS population. And this was really this is still really the only study out there that looks across states at mortality of the Medicaid HCBS population broadly, across populations. And the biggest finding, I think, that was a bit of a shock even to us was really the impact on the younger Medicaid HCBS recipients, so people under 65. What we found was the mortality rate was, for that population, was 7.4 times the mortality of other Medicaid beneficiaries and 26.6 times that of the general population. If you go to the next slide. Yeah, this just kind of highlights it. In the orange is what is called excess mortality. And what that is, it means that's, beyond what normally would be happening. And, we got data before COVID and then through the first year of COVID. And that's how we calculated what's called excess mortality. And I would point out again, this was only for the first year of COVID. So we don't know what happened after that. And again, like I would say, there's just a lot more to learn, I think, about the impacts of COVID, and something that our center is still pursuing through looking at Medicaid claims data. We're just starting, hopefully by the fall, to get access to that data to start to look at the bigger impacts on mortality, but also healthcare utilization. And the next slide. Yeah, this, and I'll let Teresa take over here, but this was a qualitative study that we did on people self-directing home and community-based services during COVID. And what we were hearing from the advocates was, oh, self-direction, people used to think that was the risky model, that was like, you had to be careful about people self-directing. But it turned out, they said that during COVID, there were so many advantages, to that model and the flexibility of that model to let people hire their workers. So we thought we did a couple videos to kind of highlight the findings, and we thought it'd be better to just show the video here if it works. But go ahead, Teresa.
At least 1.2 million people use self-directed home and community-based services. We interviewed 36 people using self-directed Medicaid HCBS to find out how they stayed safe during the pandemic. People using self-directed HCBS have control over hiring and supervising their workers. During the pandemic, participants set rules for workers, including don't come to work if you're feeling sick. Sometimes people noticed their workers were not following COVID guidelines. Participants warned their workers that they may need to fire them if they continue to be unsafe. During the pandemic, many individuals hired family members or close friends in states that allowed this. Participants trusted people close to them to prioritize their safety. When carers got sick or exposed to COVID, sometimes participants had to go without care. Hiring family members helped prevent some of these service gaps. People who are self-directing are often less connected to formal agencies. This made it difficult for these participants to find information and resources. Even if they had limited income, many participants had to buy their own masks and gloves. Accessing the vaccine for themselves and their workers was confusing and difficult. These are policy areas we need to improve for the future. Despite some of the difficulties imposed by the pandemic, people felt much safer when they had choices about who came into their home and the safety precautions they took. This is some of the first research about experiences of people self-directing home and community-based services during COVID-19. This study was conducted by the Community Living Policy Center at Brandeis University with support from the Commonwealth Fund and the Administration for Community Living. For more information, visit www.communitylivingpolicy.org.
Awesome. Hi, everyone. I'm Teresa Nguyen, as Joe introduced earlier. I'm actually going to continue speaking on some of our community living policy centers work, but then we'll transition into our equity discussion as well. So as you can see from this study and for COVID in general, for folks with disabilities, there is a lot more to learn. And so we are right now obtaining Medicaid claims data to explore further impacts on mortality and broader healthcare utilization and outcomes for HCBS recipients.
At least.
Okay. I wanted to highlight, oh my gosh. Sorry, my mouse is being a little happy right now. Sorry, guys, 1 second. Let's stay. Okay. I apologize. I think it was a play malfunction when we were showing the video. But anyways, we're on the right slide now. And I wanted to talk a little bit about some of the housing work that has been done by the center. Wanted to highlight this first study, which was led by two researchers, Tatiana Machete at Brandeis University and Kartik Trivedi, who is a Lurie graduate research assistant. This study was used the American Housing Survey data from 2017 to look at disparities in housing security for people with disabilities and long-term services and supports needs. The slide illustrates here the key findings, which is essentially that households with disabled members and those with LTSS needs live in unaffordable, poor quality, and poor neighborhood situations that also have a higher incidence of serious crime and high natural disaster risk. And we think that having this level of understanding of the types of housing issues that impact people with disabilities helps support the policy changes that are needed in this area to support community living. And that really leads us to our second study that I wanted to highlight here. And this was a study who was conducted by our center partner, DREDF, or Disability Rights, Education, and Defense Fund. Mary Lou Breslin from DREDF conducted this case study about Oak Days, which is an innovative pilot project in Oakland, California, where the county utilized a mix of Medicaid and CARES Act funding to acquire local hotels to provide both housing and integrated wraparound medical and social services for unhoused individuals with significant physical and mental health disabilities who were eligible for institutional placement. This was really an opportunity that grew out of the pandemic, and the slide here provides some details on the services and supports that were available through this program. And what we really learned was that these types of models are possible, and creative housing programs can improve health, reduce mortality, and prevent institutionalization, and services can be provided in a way that respects residents' agency and personal goals and values. We're really excited that Mary Lou and the Community Living Policy Center are still continuing research in this area of innovative housing programs. So stay tuned for more policy briefs on this topic. I'm going to now transition our discussion into some equity issues and work that's being done in the community living space. The Community Living Equity Center is a new center that was developed under a grant from NIDLR, or the National Institute on Disability, Independent Living, and Rehabilitation Research. So we know that in terms of the equity space and community living and all things disability, we know very, very little about the further disparities that people with disabilities face, especially those with intersectional identities. And we really don't know much about HCBS access for disabled people of color. And so this center is working on research and knowledge translation activities to address the gaps in our knowledge about the inequities in community living and participation experiences and outcomes faced by disabled people of color. And we're going to be developing interventions to address equity by leveraging existing and new data sources. We've talked about the Medicaid claims data. That's an example of that, using that to look at race and ethnicity disparities. We'll leverage existing and new data sources. We'll develop new policy and systems change initiatives. And lastly, we'll provide active dissemination of findings and trainings for our stakeholders. I wanted to share the center's principles, which are really rooted and centered around the experiences, needs, and realities of disabled people of color who have LTSS needs. These principles are going to be guiding our research and our center activities as we work on identifying equity issues, barriers, and opportunities in community living. I also wanted to share the community living equity framework that we've developed to help visualize kind of our work a little bit. So here we've developed kind of a systems of 3 circles, a small one, a medium one, and the larger one. This kind of represents different communities. So the innermost small circle is focused on individuals who need LTSS. And those, of course, we're looking at those with intersectional identities to really focus in on the equity piece. The second outer circle from the individual level is looking at the HCBS service and delivery system. So this is really kind of looking at what kind of cultural and linguistic training and appropriateness is needed, who uses self-direction, how does that impact communities of color, what peer support models are out there to support disabled people of color accessing HCBS, and then of course, who is leading this work in the HCBS system. And then lastly, we have the outermost ring or circle that looks at societal barriers to HCBS. So things like systemic racism, ableism, other bias in policies and practices that may contribute to the disparities that folks of color are experiencing. Our center's research and work are guided by a tremendously talented group of professionals who have expertise and lived experience in a variety of areas, including research, stakeholder engagement, and speaking on their own lived experiences, having intersectional identities as it relates to their own experiences with living with a disability. The committee guides our research through assisting in identifying the research questions and tools that are needed for our work. They also help us identify stakeholders and partners who may be missed during our equity work, processes, and documentation. And then they also collaborate with our center in identifying community priorities that are focused around HCBS equity. And so this is just a wonderful group of people who we have convened. And I think our work would not be as rich and as informative without bringing folks with lived experience to the table. So I'm going to be talking about kind of highlighting 3 of our 5 research projects that I think may be most important to our stakeholders here. A reminder that these studies are in the very beginning stages as our center is just being developed, but will provide some important information around the equity issues that are faced by disabled people of color who are accessing and using HCBS. So our first study looks at the disparities in access to HCBS and utilization. We really want to examine the racial and ethnic disparities in accessing HCBS by looking at kind of 2 data sets here, using the Medicaid claims data that we've all been referencing today, and using the American Community Survey to identify who needs LTSS, broken down by race and ethnicity, and then who utilizes LTSS, broken down by race and ethnicity. We are currently developing a data dashboard for advocates and policymakers to utilize. I'm really excited to share that later this year, and please stay tuned to continue engaging with a lot of these, I guess, products and deliverables that we'll be sharing with the community. So that I think this study is going to be the foundation for, I guess, a case in prioritizing equity in HCBS access and utilization. The second study I wanted to really highlight is our study that is looking at qualitative. So we're going to be looking at the barriers and facilitators in access for HCBS for people of color. But this study will truly highlight the experiences of disabled people of color who have transitioned out of nursing homes or other institutions back to the community. The study really has been informed and designed in collaboration with our lived experience experts we hired to conduct the qualitative interviews for the study. And through the training and dialogue, we've been able to really create interview guides and recruitment tools that will capture the complex information that we want to collect, and also be culturally relevant and respectful to the participants that we will be interviewing. This really would not be possible without our center staff who are committed to equity and our lived experience experts who are graciously transparent about their experiences and stories to help inform our work. And so this, I know, will be a really exciting studies, especially for the disability community to really understand and look at. And while we're not actively recruiting for this study yet, I wanted to share with you all a unique recruitment tool that we've created to help make the process of recruiting participants accessible and also a little bit more exciting than a flyer. This video was created by our center staff, our project lead in the research, and one of our lived experience experts. So I'm going to share that.
Hi, my name is Tyree Brown, and I'm a peer researcher for this study. I'm here today with Jennifer Lee Rambros, a research associate, and Kim Tay, the project lead for this study. We wanted to tell you about this study that we shaped and to personally invite you to participate. We're doing a study to learn more about what culture and language challenges disabled people of color face who transition from out of nursing homes to their home and community-based services. We want to know this because there's so little known in the research on this topic, and knowing more could help inform community living services for disabled people of color in the future.
You may be eligible to participate in this study if you are a person with a disability, are a person of color, lived in a nursing home or other institution, are living in the community and getting home and community-based services, or want to.
The interview will be an hour to an hour and a half long. It can be done over phone, by video, or in person. You will be given a $50 gift card for participating.
If you're interested in participating or want to know more, contact me at 781-736-8165 or at hcbsaccess@brandeis.edu.
Thank you.
Thank you.
Hope this does not happen again. Okay, So as a reminder, we are not currently recruiting, but that was just a tool that I wanted to share in how we can be creative in research recruitment. The last study I wanted to highlight in our Equity Center's work is a study on self-direction and community living outcomes for people of color. We're going to be looking at the NCI-IDD and the NCI-AD data to look at racial and ethnic differences in the use of self-direction. And then we'll also be conducting qualitative interviews with people of color self-directing their HCBS to explore equity in access, systemic barriers, and facilitators to self-direction. To inform this study, we convened an awesome work group of disabled people of color who are self-directing. And this group also includes family members who represent a family member that is self-directing. Just like the previous study that I was just talking about, the work group has helped the research team really understand the complex and important considerations to self-directing as a person of color. And like the previous study, the work group has really informed our creation of the interview guide, the research materials, and recruitment tools to really ensure that they are relevant and respectful to the participants that we'll be talking with. And so I guess to close out our equity discussion, I just really like to emphasize that our center's work is rooted in community building and community partnerships. And the planning for the partnerships and research collaborations took place long before the research teams began their work. Some of this work includes prioritizing a budget to appropriately incorporate the lived experiences of disabled people of color who have expertise in the specific HCBS topics that we're interested in. It also includes relationship and trust building between the researchers and the communities that we're interested in learning from. And lastly, it takes into consideration the different modalities of accommodations that are needed to support disabled people of color who are involved in our research from the beginning to the end. And so I know that there has been a chat dialogue about how you can continue to follow our work. So please don't hesitate to visit us at communitylivingequity.org. And I'm going to pass it over to Joe to close us out.
Graham. Before we close out, Teresa, there was a question I thought you'd be good to answer about the training for the lived experience experts, because that's something we've really been doing a lot of thinking around. And so I don't know, do you want to say anything about how we approach that and what kind of training we're doing with the lived experience experts?
Yeah, thank you, Joe. Yeah, and I'm happy to connect over email for materials and stuff related to this. But yeah, the training piece took a lot longer and was involved much more than we had anticipated. That's even with the budget. We had to edit our budget many times to really make sure that the training was appropriate and enough for our lived experience experts. But the trainings were conducted by the project lead and also our center project coordinator, who also both identify as disabled people of color. And I think that really helps build some rapport with the lived experience experts that we were hiring. And the training really consisted of your usual generic research training in terms of institutional review board certification, and other kind of university onboarding materials. But it also took a lot of time to really dive deep into the race and disability aspect of our research interests. I think that our process with our groups are a testament to how little we know about how race affects folks who utilize and need HCBS, because it was really hard to even just conceptualize that for a number of weeks with our lived experience experts. And so there were facilitation tools that were used to really kind of, again, help us dig a little bit deeper into such a heavy topic, and a lot of background support that was included in the training that was led by our project lead and project coordinator. And so that background support really included how did we train the lived experience on how to fill out a W-9? And how do folks invoice us? And what does that look like? And so, and there are personal kind of office hours that our research team holds so that the lived experience experts can check in with us on a variety of topics, whether they be logistical or to even just understand the emotional impact that they'll be experiencing when they interview our community. And so happy to, again, connect over email. I'll put that in the chat.
Yeah, thanks, Teresa. Yeah, and thanks everyone for the discussion. There's been a lot of great stuff coming in on the chat, and we're gonna, take that information as part of this discussion. I saw people, some of the chats, some of the topics that people were highlighting around the issue of paid family caregivers, research on that, but also still barriers in states to allowing family caregivers to be paid. There was some chat about LGBT and home and community-based services, which is a topic we don't know a lot about, particularly for younger people with disabilities. Housing, inclusive research. There's a lot of great stuff that was coming up. So definitely share your insights through that survey if you can. And yeah, Amy just put it in the chat again. And yeah, join us for the future webinars that we highlighted at the beginning, the panel discussion, and then the findings from the roundtable, which I think you'll resonate with some of the stuff that came up today. And then what we're planning on doing is taking all this, the roundtable reports, feedback we get from the survey, and put it all together in a report that would come out this summer about, what do we know and what do we need to know? What's the priorities for community living policy research? And we hope that can be a document that policymakers can use, also funders, foundations, people that fund research could use that document, to sort of get a sense of what research is needed. And Teresa, the next slide. One plug for researchers, and I know there's some researchers on the call, that we're doing a special issue of the Disability and Health Journal that's going to focus entirely on community living policy. And so if you have something, a research article to submit to that journal, we're taking submissions through September 1st. So keep us in mind for that special issue. And then just lastly, here is some contact information. Follow us on Twitter, and our websites are communitylivingpolicy.org. And then we just launched the Equity Center website where you can find more information about those projects, and that's communityliving.equity.org. I think with that, I'm just going to close this out, and thanks everyone for participating, and see you in the next webinar. Thanks.